Hello, my name's Ben Shippey. I'm a consultant in anaesthesia and intensive care medicine in Dundee. And I'm really grateful for you taking a few minutes of your time to listen to me tell you how you might make a real difference to stage safety this weekend. If there is an incident in a stage this weekend, you're going to be the first people there. We are not going to get there first, we're going to come in response to what you tell us. So what we need to do is give you some simple things that you can do to make that safe and effective for you and useful for us. In effect, what they are a safe approach to an incident, some early, simple first aid, and some information that you need to gather and pass on to the stage rescue services so that we can assist you. If you see an SOS board in the stages this weekend, you must stop. You must find out what the problem is, and you must pass that information on to the next competitor, who will then pass the information on to a radio point. You've then got to make an assessment of the situation and do some basic first aid. Do that safely. Decide whether it's safe for you to approach the vehicle. Use the car if you can to protect you from other oncoming cars. Stabilise it as well you can. And if there is a risk of a fire or an actual fire, activate the vehicle's fire extinguishers. Isolate the electrics before you go anywhere near the vehicle. Establish as far as you can some information to pass on. You need to know what's happened, you need to know where it is, you need to know the number of the car and the number of casualties. It's also really useful if we've got a brief description of what's the matter with them. We're not looking for diagnoses here, but conscious, unconscious, breathing, not breathing, pain in leg is really useful for us to decide what to do. To do that, you need to talk to the casualty. Approach them from the front. One of the things we're trying to do is stop them moving their necks, and if you come at them from the side, they will turn to look at you. So come at them from the front. Ascertain whether they're conscious or unconscious. Talk to them. If they talk back, they're conscious, it's all good. If they're not, we need to move. We need to open their airway. And people can sometimes be very worried about moving the neck in this situation. Don't be. Open the airway. You can do that by putting 2 fingers behind the angle of the jaw and pulling forwards. Air should start to move. If they're breathing and air is moving, we can relax. If they're not breathing, they need to be out of the car. Undo their straps, cut them if you have to, pull them out, do not worry about moving the cervical spine. Lie them on their back, put your hands on the sternum, push down about 2 inches or 4 centimetres if you've moved to metric. Release and press again. Repeat that about 100 times a minute. Don't stop until we get there. If the patient is conscious, but they're in pain or unwell, there are some things that you can do to help them. They might be shocked. That means something a bit different to us than it does in the media. It means they're bleeding so much that they can't maintain their blood pressure. If you can see where that blood's coming from, put a dressing or a handkerchief onto the wound and push hard. Keep pushing. Don't stop until we get to you. If there's a fracture, it will be painful. Don't try and straighten it. Support it with a sling or a limb or rest it on something. Leave it there. We will get to you and we will straighten it. If there's a burn, you can cool it by pouring cold water over it if you've got some clean water, and covering it with a plastic bag or some cling film just to keep the dirt and infection out. Leave that there. Don't be tempted to keep looking at it. We'll deal with it when we get there. When we do, don't stop what you're doing. You can be really helpful to us in controlling the scene, reassuring and looking after casualties, and we want to know from you what you've found and what you've done. So in summary, look after yourself this weekend. If you do come across an incident, stop, make a quick assessment, pass some information on, look after the casualties that you find and stick about. I hope I haven't put you off having had a great weekend, and I'm really looking forward to seeing you out on the stages sometime soon.